Hi, my name is Amanda, and this is my presentation on my applied practice experience done at Providence Children's Center. So, the purpose of this report is to demonstrate my ability to take what I have learned throughout my time in the program and really apply it to a real world setting. So, products produced during the applied practice experience will be shared to emphasize the competencies that I met in order to fulfill the graduation requirements. So I was fortunate enough to complete my APE at the organization I already work with, which is Providence Regional Medical Center Everett, and more specifically, Providence Children's Center. My site supervisor was Shanna Van Horn, and prior to beginning, we had created a plan to work on products that were much needed but had been kind of placed on the back burner due to a lack of time and resources. These products include an analysis of program timelines as well as a monthly newsletter. So, Providence Children's Center has two programs. There's the Pathways program and the Early Support for Infants and Toddlers program, also known as ESIT. These programs can vary by timeline requirements, location of services, and age, to name a few. The creation of the monthly newsletter was targeted towards both programs, while the analysis of timelines is specific to the ESIT program. So, when a child is referred to the ESIT program, it can come in various forms, such as a primary care doctor, a hospital upon discharge. It could come from the NICU, or even a parent self referring. It is a federal program, and part of the contract we have with the local lead agency in our county is that any child found eligible will be enrolled within 45 days of receipt of referral. And so each family will receive a family resource coordinator who helps guide them throughout the process and sticks with them, as well as a therapist who will complete an initial assessment to determine eligibility. So 31 referrals were analyzed that were received between the months of May and June. This is just a small sample of those referrals received in those months. In order for a family to be eligible for services and to complete the enrollment process, they must be eligible by having one of the following criteria: either a 1.5 standard deviation or 25% delay, a diagnosis likely to lead to a delay in development, or informed clinical opinion must be utilized. So, of the 31 referrals that were analyzed, one child did not qualify for services, one was unable to be contacted, one has not yet completed the enrollment process, and then 6 families declined services at some point in the process, which is completely their right. Through discussion with my site supervisor, we had determined 5 areas to evaluate that kind of play a crucial role in the amount of time it would take a child to receive therapy services. So the first was to look at the number of days between when a referral was received and when intake got a hold of the family and confirmed their interest in the Early Support for Infants and Toddlers program. The child is then added to a list, and a therapist is assigned every Tuesday to any new child on that list. So we really wanted to take a look at the number of days, not only from when the referral was confirmed, but from when they were added to the list and a therapist was assigned. We then wanted to take a look at from when they were assigned to when the initial assessment was completed by the therapist. And then from there, further looking at the number of days between when the assessment was completed and when the individualized family service plan was completed. In addition, we looked at the time between when we received the referral and when the family resource coordinator made their first attempt at contact. So these are really important because they give us a better picture of that 45-day timeline and the average number of days each step takes in the process. When a family completes the enrollment process, if the 45-day timeline is surpassed, there must be a justification as to why there was a delay in services. So their choice is either to mark exceptional family circumstance, which would suggest that the family caused the greatest delay in accessing services, or it can be marked as other, which would typically account for a delay on the provider side of things. When assessing the reasons there was a delay, approximately 10% of reasons fell into that other category, with the remaining 90% falling under exceptional family circumstance. When documenting the cause for delay, it was determined about 55% of parents reported a delay due to illness. So typically that would be a cancellation causing a reschedule. 30% reported delays due to their travel schedules or being unavailable to meet anytime sooner. and 5% was accounted for no-shows to their appointments. As a result of the data that was gathered and analyzed, a PDSA cycle of change was created, which stands for Plan, Do, Study, Act. In evaluating the program timelines, a PDSA was created with the intent to reduce the average number of days each step in that enrollment process takes. So we would do that by creating the plan. And then next we would do the do portion of it, which would be making changes and recording the results. That would then lead to studying the results of change and whether change was made towards what we are striving to accomplish. We would then act, kind of determining those next steps and what we need to adopt, adjust, or abandon before repeating the cycle over and over until a desired outcome is reached. As you have seen during my APE, I gathered this data and analyzed it to better understand the current length of time each step takes. Why, you may ask, is this important? Well, not only are we contractually obligated to fulfill the 45-day timeline, but early intervention has been proven to be beneficial to long-term health outcomes for children with delays and disabilities. This analysis led to an evaluation of current program processes and the creation of the PDSA cycle of change. While that PDSA is an ongoing process, the data has really paved the way to implement the necessary changes at each step to reduce the length of time it takes for a child to access services. The next product I will share that was worked on during my APE was intended to be utilized by both families in the Pathways program as well as the ESIT program, but not only that, but children on the wait list for Providence Children's Center. So with the Pathways program, a child can wait up to a year before they're able to complete their first appointment. And it's pretty common around the county. That's typical for wait times at this time. So ensuring families have access to resources in the meantime, especially those that offer preventative measures, can be very beneficial to long-term health outcomes. The newsletter contains information on classes hosted by therapists at Providence Children's Center, such as a lunch and brunch at the park with speech-language pathologists. It offers activities for families, such as a sensory scavenger hunt that was provided by occupational therapists. It contains resources from other organizations that we partner with, such as the ARC of Snohomish County. And so a family can really build a sense of community, access additional supports, and begin those preventative strategies in the meantime. Collaboration has been a significant component in the creation of this monthly newsletter. It was very important to utilize those around me, especially those who are just as passionate about caring for our youth. And so to do so, input was gathered and resources were shared amongst providers to create a database of information that can and will be used in future editions of the newsletter. Creating a monthly newsletter has been a passion project I've hoped to do for many years. This APE allowed me to dedicate time to the creation of this newsletter in a manner that will make it easy to maintain from here on out. I always knew I wanted to integrate other disciplines, and many providers expressed interest early on as we all see the need for that additional support and resources for the community we serve. While not all components of this project will fit the needs of each family, the goal is to bring awareness to the different resources available and hopefully reach a wide array of families with new resources, events, and more each month. During my APE, I was also fortunate enough to expand Providence Children's Center's network, such as partnerships built with the ARC of Snohomish County. This was initiated through team discussion on how we can work with other organizations in the community and identifying those that our families could benefit from most. So family resource coordinators and staff from the ARC of Snohomish County came together to create a plan and discuss ways in which we can work together to continue to support the same communities that serve the families in both organizations. In addition to this partnership, I've also been part of what's known as the Family Interagency Coordination Council, or Family ICC. This council is comprised of individuals from various backgrounds and other organizations, as well as parents who have been throughout the program with their child. Through brainstorming ways in which we can expand our reach, we were able to organize a resource fair with the Snohomish County Health Department, as well as Early Head Start. With expanding networks, we have continued to brainstorm on how we can bring other stakeholders into the family ICC who can offer new perspectives and knowledge. This has been an amazing and really enlightening experience, and it has shown me my strengths and weaknesses and things that I can improve on and things that I wasn't aware of before. Taking the knowledge that I have learned inside the classroom and applying it to a setting that's typically focused more on individual care really pushed me outside of my norm and encouraged me to explore components of public health that were already there but just weren't so apparent. I feel confident in now applying my skills to a new setting and situation and understand that the reach of public health is found far and wide. So, the following highlights activities that were completed during my APE to support those products I worked on. Thank you.